first guests from the Jackson County Health Department, Health Officer Kristen Pluta and Public Health Nurse Cindy Wolfinger. Welcome to the show.
Thank you for having us again.
Merry Christmas.
Thank you.
To you.
And Cindy, with a name like Wolfinger, is of course from Grass Lake. So is the town all still abuzz over Braden Lake?
It is. Everybody's very proud of him.
I was almost surprised he was back at school today, but he's returned to normal.
Good for him.
Yeah, good for him. So I think his incentive is to get in shape for basketball, which starts, the next game is next week for them.
Oh, yeah, I would imagine. I'm sure he's pumped to be back with his friends.
Yeah, he is. So we're seeing, with colder weather and the season, people are sick. In fact, there's people at the health department that are sick right now, aren't they?
Yep, you got third string right here.
Yeah.
We are the third string. First string fell out to COVID. Second string fell out to COVID. So now you get Cindy and I. We were studying back there to figure out what we were going to talk about.
Well, we're down a couple here at JTV as well, and I think let's talk about that because we've got a few things going around, and people could have one, two, all three at the same time, right?
Yeah.
What are we dealing with?
I mean, I don't know how often all three is actually happening, but they all have very similar, symptoms and whatnot. So the best thing people can do is if they're having any sort of symptom at all is just to make sure that they stay home. It stinks with the holidays being here, but better to stay home and protect themselves and their families than risk exposing everyone.
Now, when people start to feel bad, and I think everybody goes through this, the fear is, oh my gosh, I've got COVID, and they do the test. And what we've learned here, and I've heard from some of my friends that the home test, it's not that reliable, is it?
Unfortunately. I mean, it's the best they have right now for doing at home, but it doesn't hurt to test because it does give you some accurate results. But
and if you get the test, when you test positive, then you do get that assurance to know, kind of your quarantine guidelines and know that you're sick and know that people around you
and that's
mask and stay away. But if you're sick, stay away.
Stay home. Stay away.
Yeah, stay
no
home,
matter
stay
what
away.
it is.
And I think we've all been in work situations where we've had people that have come in and it's like, no, I'm going to trudge on, I'm going to work through it. And it's a bad idea.
Yeah, that's one of the things I was talking about yesterday. I think I had heard that there was a lot of kids out of school and stuff. I mean, I remember the days of sending my kid to school saying like, no, you're going to school. And so I think we're going to see that now that people, coming out of COVID, people are keeping their kids home when they're sick, and we are staying home when we're sick. And I know there's policies and things that are changing in work environments that like it's okay to be sick. We don't have to push through and come in and expose everyone else in the building too.
Yeah, and it could, during your work days, could suddenly start feeling sick. Go home.
Yep.
Yeah.
We've had people leave. The protocol for COVID, isolate, quarantine, all that. That's not bad advice for anything else that you have that might be communicable.
That's right. So, I mean, to help prevent it, though, we are still recommending that everybody get their vaccines. So, unfortunately, there's not enough time before Christmas to become fully vaccinated, but even if you were to get your flu shot right now today, you'd be a week into, so like halfway.
Yeah, they say about 2 weeks
protected.
For, this is what Matthew says,
Yes.
so I'm going by
our expert.
Our expert, but yeah, he's trustworthy. But about 2 weeks before you're really fully vaccinated from, with the highest protection you're going to have for influenza. So get your flu shot.
Yeah, I got mine in, I think, October, so, and they last the whole season, right? Don't need a booster for a flu
Correct.
shot.
No booster.
We're good till next year.
So
But
Matthew,
we are seeing that the past couple years, flu has been a little bit more mild, and we think this year it's ramping up a little earlier than previous years, and flu may be, a bigger impact to us this year.
well, one year we didn't have any flu because of the COVID.
Yeah, everybody was isolated away.
So Matthew Budd, who we're talking about, is also a public health nurse, as is Cindy. And Matt sent some slides about the rise in certain things. RSV for one. Let's take a look at the trajectory of this virus. So is this?
Oh, this is the RSV. Yeah,
RSV,
overall
okay.
hospitalizations for RSV. So you can see this graph is kind of backwards from what I normally see. Is it? Am I looking?
Yeah,
at
it's a little bit backwards.
This is what happens when you have third string. We're trying to figure out what we're looking at right now. I'm going to let Cindy to manage this one.
So you've got the full years that are kind of low, those low lines. And then it's kind of hard to tell, but that bright green line that only shows October through December is where we're at already for this 22 to 23 season of RSV. So already we're at our highest that we've been in, 3 or 4 years. And we're just a couple months into this flu RSV season.
And I never heard of it before this year.
It's typically you only really hear about it with kids. So for years and years, it's been one of the biggest causes of illness in, your babies and your toddlers, because they just can't handle it as well as older people can. But it's typically for you or I, it'd just be a common cold, and we wouldn't even really realize we had it. But it's having a big impact on those young ones.
Yeah, and statistically, it would appear that we could have 2 to 3 people kids in the hospital with RSV.
Correct. Yeah, and I think things are doing a little bit better now, but just in the last couple of weeks, there's been stress throughout the state as to running out of pediatric hospital beds. So.
Yeah, what's going on? We have a shortage of meds.
Shortage of meds, yeah. You can't find Tylenol or ibuprofen or anything like that anywhere right now.
What's going on?
I don't know if it's a manufacturing thing or what. It's scary though.
And some prescription meds also are in short supply. Yeah.
Yep.
All right, and I think we've got a couple other graphs that Matt sent. Oh, wow. Is this good or bad?
That's not good.
Yeah, that's bad.
Those are urgent care and emergency department visits that when they leave those centers that they're diagnosed with influenza. So see from pretty low there, October, November to December 1st, pretty. And that's all through
spike.
Michigan.
Mm-hmm.
Michigan, urgent care and emergency department visits for flu.
Yeah, flu diagnosis.
And there is some medication for flu.
There is.
Is there a shortage of it?
I don't know. I know it's kind of expensive medication, so in years past that they've been a little bit stingy on prescribing it unless you really need it. But I don't know about a shortage.
I haven't heard a shortage of it, but I just because I haven't heard it doesn't mean it's true.
And Pavlov, we've got plenty of that. And that's the Pfizer pill for
COVID, yeah.
Now, what are you doing at the health department? Are you doing any testing or anything?
We don't do testing at the health department. We have tests that are available. We have tests that are available for the community that don't require any. We can just give them to community partners who need them, or if someone requested them, we can give them to individuals. But we don't do the testing ourselves there. We're actually working on. Our health resource advocates are working on a kind of back to school or over the Christmas break distribution of some tests that we received that are just for school-aged kids. So more information to come out about that.
Oh, really?
Yeah, they're working on, because what we've realized is, last year we did I think we did a testing clinic last year before the kids went back to school after Christmas break. And this year we were thinking just get those tests into their hands, into the parents' hands, so they can test if they need to. Not necessarily encouraging, that everyone tests before but at least we can get them in their hands so they can test if they need to.
Yeah, remember those days we were having testing clinics, vaccine clinics in the schools and fire departments. But you're still encouraging as you said, the flu vaccine, but also
and the COVID vaccine.
COVID, yep.
Yes, and we are doing both. We have COVID vaccines and flu vaccines at the health department.
And people can just walk in?
Yes, but it's for Medicaid and Medicare. We only take Medicaid and Medicare. For flu, for COVID, it's still for anyone. That's available for anyone.
Now.
For now.
Next year it might change. We're
Might
hearing
change,
that
yeah. But we can do
Pfizer's-
COVID vaccines for
Yeah,
anyone.
Pfizer's
So.
going to jack the price up on it. So get your, we don't know if it's going up. The federal government's been subsidizing it anyway. They probably will continue. And you can get both flu and COVID booster same time.
Same
Yep.
time. Yep.
What other things people need to be concerned about during the holidays, besides trying to stay safe, stay healthy, and not get any of these respiratory illnesses?
Yeah, so with my role in trying to promote healthy and safe lifestyles for all of our babies and children, we are promoting that there's different holiday safety tips. So just different things like making sure, I touched on this in October when I was here for Safe Sleep Month, but making sure as you're traveling with your young ones that you're still promoting safe sleep for your babies. Just because you're traveling and you don't have maybe their normal sleep environment doesn't mean you should put them in your bed to sleep with you. Worst case scenario, if you don't have a pack and play or any sort of bassinet that can travel with you, worst case, you can actually use an empty box, put it on the floor and let baby sleep in that as long as there's nothing else in it. It sounds awful to say that, but the box is safer than putting the baby in the bed with you. So making sure you're still doing that. With all these new gifts that kids are going to be getting, making sure if anything has any sort of like button battery in it, making sure you're keeping that away from your toddlers. That can cause some scary long-term problems. A lot of kids will get that button battery out and think it's, a piece of candy or whatnot. And that can actually cause holes in their esophagus or stomach lining and when they swallow it. So making sure you're aware of what's in your kids' toys. Different things like promoting fire safety. So making sure if you have a real tree, make sure you keep that watered. The fire department will appreciate that. As well as if you have a fake tree, making sure that it's flame retardant. And then also if you have any sort of holiday candle, keep that away from anything. Keep it at least a foot away from anything that it could possibly catch on fire.
Gifts are big right now. Choking hazard. Buying age-appropriate gifts for the little ones in your family and friends. Make sure they're age-appropriate. A lot of the stuff now has buttons and little gadgets and little things.
And use common sense because even though the government says it's safe for certain ages, use your own. You decide what's safe for your kids.
You know your kids. You know what they can handle. But making sure that you're not just sending them to the basement to play with their cousins, that somebody's paying attention to them as well.
Yeah, and there's certain things at the holidays that people are burning more candles, Christmas tree. Poinsettias, they're poisonous, aren't they?
Yeah, they are, as well as what we were reading.
Holly berries, mistletoe berries,
and Jerusalem cherries.
Yeah, I don't know what I don't have these. I can't keep plants alive in my house, so
I have an aloe plant that's
from this. So, but yeah, the berries, and of course, so that immediately makes me think of the kids, right?
Yeah.
Like you see these red berries on these, little plants. What do they want to do? They want to eat them. So.
Your pets too, keep them away from the poinsettias.
Yeah, so there's so many distractions, but number one, your family safety, priority, always.
Yep.
Now, are you both ready for Christmas?
Got some wrapping to do, but other than that,
Oh, nice.
I'm not. I don't even have a lot to buy for anymore. My kids are old. One's sending some. Well, he might be watching. Not dead. He's in Japan, but he won't be back here, so we don't have like real gifts to do. But I'm just not ready. I don't know. It's different. The older my kids get, the different, that kind of prepare. It's great having them home.
Your kids are still planning on getting gifts from you, so don't. Just because you don't see them doesn't mean they don't want them.
No, they want Amazon because there's Amazon Japan. There's like a separate Amazon Japan. It's Amazon, but it's like
I'll have to check
they want
that
money.
out. Yeah, money. Well, you guys have a great Christmas. Everybody stay safe and healthy, and good to see you both.
You as well.
Kristen Pluta, Health Officer, and Cindy Wolfinger, Public Health Nurse with the Jackson County Health Department. More to come on